Welcome to the Allura Home Health Vlog. This is a spot where you can get thought leadership, information on topics that matter to your agency today.
You know, when you think about it, your home it's your most personal space, isn't it?
Absolutely. It's your sanctuary.
So when a home healthcare agency comes in, they're really stepping into that private world.
Mm-hmm. And building trust is paramount.
So how do these agencies make sure they're providing the best possible care and really earning that trust?
Well, I think it really boils down to listening, actively listening and learning. In other words, getting and using feedback.
Right. Feedback. It's crucial anywhere, but maybe even more so here.
Definitely. Knowing what's working, what isn't. It's vital when you're dealing with someone's health and, their peace of mind right there in their own home.
So today, we're doing a deep dive into that, how agencies can leverage feedback.
Exactly. We're looking at all sorts of feedback, online reviews, internal stuff like incident reports, even what staff say when they leave.
Okay, so multiple angles, online reviews, that feels like the modern word of mouth, right?
Spot on. It's huge what people see online. It shapes perceptions immediately. It's often the first impression.
And there's a formal system for this too, HHCA-HPS.
Yes, the Home Health Consumer Assessment of Healthcare Providers and Systems. HHCA-HPS. It's the national standard run by CMS.
CMS, right. Centers for Medicare and Medicaid Services.
And it gives those star ratings people see. They're a snapshot of quality and patient satisfaction.
So what exactly do they measure? Is it just a general feeling?
Oh, no, it's quite specific. They look at the care team's professionalism, how well they communicate.
Communication, always key.
Definitely. And whether patients would actually recommend the agency. Also, did the staff talk about things important to the patient?
Okay, and quality too.
Yep. Timeliness of care, were they showing up when expected? And crucially, the outcomes. Did the care actually help?
That's pretty thorough. So for an agency listening, what should they do with these HHCA-HPS results?
First off, look at them regularly, consistently.
Not just glance once a year.
No. Compare your scores. See how you stack up against competitors, against state averages, national averages.
Yeah, benchmark.
Exactly. It shows where you're strong, but also, maybe more importantly, where you could improve.
And what about when the scores are good?
Celebrate it. Recognize the team. If you see improvement, especially in those core areas we mentioned, acknowledging that hard work reinforces it, it tells your team this matters.
Makes sense. Now, beyond the formal surveys, you mentioned just Googling.
Yeah, don't underestimate a simple Google search. You find those anecdotal comments, the stories.
Less structured, maybe?
Less structured, yes, but sometimes richer in detail. You get the nuances, the specific good things or the frustrations people felt. It's valuable, qualitative data.
Okay, so inevitably, you'll find a negative review. What then? Panic?
Huh? No, don't panic. Think service recovery. The Agency for Healthcare Research and Quality, AHRQ, has a good framework.
6 steps.
6 steps.
Okay, what are they?
First, apologize. Sincerely.
Even if you don't think you were wrong.
It's about acknowledging their experience. Then listen. Really listen. Ask questions to understand.
It's okay. Apologize, listen. Step 3.
Fix it. Quickly and fairly. Then offer some kind of atonement. Maybe it's a discount, maybe just reassurance. Depends on the situation.
Atonement. Okay.
Follow up. Make sure they feel the issue was resolved. And finally, remember your promises. If you said you'd do something, do it.
That sounds like a solid process.
Yeah.
Turning a negative into, well, maybe not a positive, but at least showing you care.
Precisely. And look for trends in those reviews, too. Is the same issue popping up again and again?
So it might point to a bigger systemic problem.
Could be. And when you reply publicly, be tactful, professional. Remember ACE-PA, always.
Right. No personal health details.
Never. Offer to take the conversation offline. Give them a contact person to resolve it privately.
Okay, that covers the online world. Let's pivot now. What about feedback from inside the agency? Internal evaluations?
Hugely valuable. This is where you can often catch things early. Think about incident reports.
Usually just documenting what went wrong, right?
Often, yes. But
Yeah.
could they be more? Could the person reporting suggest how to prevent it next time?
Oh, interesting. Build that into the form or the process.
Why not? It's an untapped source of improvement ideas right from the person who saw the issue.
And what about less formal stuff? Like a patient mentioning something to their aide.
That's crucial too. Those informal concerns, the grumbles, little suggestions. You need a process for that.
So the aide knows what to do with that information.
Exactly. How do they manage it? Who do they tell? Does it just disappear, or is there a channel for it to reach someone who can actually act on it?
So it's not enough just to hear it, you need to capture it.
You need a system. Doesn't have to be fancy. A database may be part of your software, even a dedicated log, somewhere to record incidents and these informal concerns.
Why? What's the benefit of logging everything?
So you can see patterns. Track trends over time. Are small issues becoming bigger ones? Are things falling through the cracks? A central system helps prevent that.
You mentioned Dr. Wendy Liebov earlier. Did she have specific advice on handling complaints internally?
She did. 5 key components she emphasizes.
Okay, what are they?
1, have a clear way for customers to give feedback. Make it easy, encourage it.
Makes sense.
Define steps for frontline staff. What can they handle themselves? When do they escalate? Empower them, but with guidelines.
Right.
3, have a process that goes from that immediate service recovery we talked about all the way to fixing the root cause. System improvement.
Got it. Service recovery and prevention. 4.
Clear policies. How are complaints managed? How are they tracked? Everyone needs to know the procedure.
And 5.
Training. Educate all staff on service recovery.
Yeah.
Everyone plays a part. It's not just one person's job.
That sounds like a really comprehensive approach. Okay, so we've got online, internal. What about staff who are leaving? Exit interviews.
Oh, definitely. Exit interviews or even online surveys for departing staff. They can be gold mines for understanding turnover.
Why are they so valuable? People might just want to vent, right?
Sometimes, sure, but often someone leaving, especially if they have another job lined up.
They feel safer being honest.
Exactly. Less fear of repercussions.
Yeah.
They might genuinely want to make things better for the colleagues they're leaving behind. Their honesty can be incredibly insightful.
So what kinds of things can you glean from those interviews?
All sorts. Gaps in training, maybe.
Yeah.
Lack of mentorship, issues with the urgency culture, problems with processes that just make the job harder.
So listening to departing staff can pinpoint real friction points.
Absolutely. If you do them consistently and analyze the feedback, you'll start seeing patterns that might explain why people are leaving.
Okay, so we've covered external, internal departing staff. What about just general ways to keep feedback flowing all the time from current staff and patients?
It really comes back to culture, doesn't it? You need a culture where feedback is genuinely welcomed, not just tolerated.
Easier said than done sometimes.
True, but the payoff is huge. You spot emerging issues faster, and you can check if changes you made actually work.
And the key is making people feel safe.
Absolutely critical. Avoid a blame culture at all costs. Staff need to report concerns, even mistakes, without fear. Patients need to feel comfortable speaking up, maybe even anonymously.
So anonymity can be important.
Can be very helpful, yes. Frame it all as learning. Errors happen. Often they're system errors, not individual failings. Let's learn from them.
How do you actually get that ongoing feedback? Specific methods?
Lots of ways. Anonymous surveys, for sure. Employee satisfaction, culture surveys.
Okay.
Open door hours with leaders. Maybe forums or discussion sessions during staff meetings.
It's dedicated time for it.
Yeah. Simple suggestion boxes, physical or online. Low pressure.
Good point.
And crucially, follow up with patients who raised concerns earlier. Show them you listened and took action. Closes the loop.
Right, closing that loop shows it wasn't just lip service. Okay, this all sounds great, but how does it look in practice? You mentioned looking at bigger, successful agencies.
Yeah, you can learn a lot by seeing what the established players do. They often have well-honed practices.
Even if you're a smaller agency.
Especially then. You can adapt their principles. While every agency is different, you see common threads among the leaders.
Okay, like what? What are some of those common traits?
Well, one big one is a really ingrained culture of compliance.
Compliance. Doing things by the book.
More than that, it's proactive, building compliance in from the start, not just reacting when something goes wrong, thinking ahead.
Can you give an example?
Think about Vitas Hospice. Grew to be huge. They built their whole model on strong ethics and compliance before a lot of the formal rules were even there. They prioritized doing the right thing.
That's tough though, right?
Yeah.
Regulations change constantly in healthcare.
They do, and these larger agencies make staying on top of it a major priority. They dedicate resources, people, budget to understand and implement changes. It's non-negotiable for them.
Okay, so compliance culture is one. What else?
Giving real attention to putting the right people in place. Every single employee matters.
From leadership down to the frontline caregiver.
Absolutely. The aides spending time with the patient, the scheduler in the office, they all impact the experience and, honestly, retention, both patient and staff.
So they focus heavily on recruitment and keeping good staff.
Very much so. Rigorous hiring, yes, but also focusing on making it a place where good people want to stay.
Makes total sense. Compliance people.
Yeah.
What's the third trait?
Staying open to opportunities, especially growth opportunities.
You mean like mergers and acquisitions?
Exactly. The home care industry has seen a lot of consolidation. Think about PDGM changing payments.
Right, the patient-driven groupings model.
Yeah, that shook things up. And the CARES Act had impacts too. Big agencies often grow by acquiring smaller ones that add value maybe geographically or a special service or just good staff.
So they're always looking for strategic ways to grow and adapt.
Pretty much.
Yeah.
They don't stand still. Compliance, people, and openness to opportunity, those seem to be key themes.
That's really insightful. Okay, let's bring it back to the individual leader listening right now. What about their own role in receiving feedback?
Self-awareness. That's huge.
How so?
Do you really know how you come across? Are you truly listening when someone gives you feedback, or are you already mentally drafting your reply?
Guilty is charged sometimes. It's easy to do.
It is. Leaders are busy. But consciously pausing, setting aside your own agenda for a moment, engage in active listening,
Meaning?
being fully present, not judging immediately, really trying to understand the other person's viewpoint before you react. It takes practice.
A powerful reminder.
Yeah.
Okay, so wrapping this all up, what's the main takeaway, the core message for our listener today?
It's just the essential nature of feedback, actively seeking it from all these different places and then using it thoughtfully. It's not optional, really.
It's fundamental.
It's fundamental for improving quality, efficiency, reputation for long-term success. It's how you get better.
Okay, a really clear message. So here's a final thought for you, our listener, to mull over. What's one concrete feedback strategy, just one thing from our discussion, that you can implement in your agency, maybe even starting tomorrow, to uncover some valuable insights?
Yeah, think about it. Which source online internal staff feels like it holds the most immediate potential for learning and growth in your specific situation right now?
And, this deep dive is brought to you by Allura Home Health Software.
And they're really all about being that comprehensive solution for agencies,
Yeah, like that one platform that you can manage almost everything from.
Which is interesting because Allura seems to really want to keep the whole industry in the loop.
Not just about their software.
Right, but about all the latest developments and regulations and, even just the news that affects agencies. They really are a top provider of home health software for both skilled and non-skilled agencies.
And when they say complete agency management solution, they mean it.
It really is designed to help everyone from the CEO to the caregivers in the field.
Head over to allurahealth.com or give them a call at 1-800-954-8250 for a free software assessment.
They can help you take your agency to the next level.
And that's a wrap for this deep dive.
Until next time.
We'll be back soon with more insights and advice to help you navigate the ever-changing world of home healthcare.
Stay tuned.